My project was over Ccam, and Ccam is congenital cystic adenomatoid malformation. And so the patient is Joanne Dean, and she's a 29-year-old who is 22 weeks pregnant, and she was coming in for her 20-week anatomy scan. She's been pregnant twice, and she's had a full-term delivery and one successful delivery resulting in one child. So they performed the exam. They found these pictures in the fetal thorax. And so right here is just a picture that they measured of the lungs. And within the lungs, there are anechoic structures within. And then this is also picturing the thorax with the heart. And the heart is also has anechoic fluid underneath it. And then some other pictures they took of the fetal thorax includes more anechoic structures. These look smaller, and then there's also some bigger components. And then this is another picture of just arrows. And so with the lungs, the lungs look like it's compressing other organs. And so the obstetrician reviewed the images that the sonographer turned in, and she diagnosed the fetus with Ccam type 2. And Ccam type 2 is macrocystic with microcystic components. And so Ccam is just a multicystic mass that's found within the lungs, consisting of primitive lung tissue and abnormal bronchial structures. And once again, Ccam type 2 lesions are macrocystic with microcystic components. And so there's three types of Ccam. There's Ccam type 1, which is macrocystic, and there's Ccam type 3, which is microcystic. And type 3 is usually the most fatal. It has the worst prognosis. And so some causes of Ccam is just some overgrowth of abnormal lung tissue that may form fluid-filled cysts, and the cysts may prevent the tissue from functioning as normal lung tissue. And so the malformation can also communicate with the bronchial tree, and the cysts can be small or they can be large. It just depends with the type of Ccam that the fetus has. And it normally has a variable texture, and it can be solid, mixed, or cystic. And most structures are unilateral, so it's either on the right lung or the left. So some differential diagnosis is that Ccam may be confused with a bronchogenic cyst if it's Ccam type 1. And this is because they're both cystic, and bronchogenic cysts are just anechoic structures found within the lungs, and macrocystic are just larger cystic components of the lung. But the difference between the two is that a bronchogenic cyst does not communicate with the bronchial tree, and Ccam does. And so the treatment just all depends on the type of Ccam, what's going on with this malformation, and the severity of it. So the prognosis is poor when there's a presence of polyhydramnios, hydrops, or cardiac deviations, and this can cause esophageal compression and prevent the fetus from swallowing. And so in type 2, chromosomal abnormalities are usually more common, and then there's also associated anomalies. And these anomalies may include renal agenesis, pulmonary anomalies, and a diaphragmatic hernia. And so if it's not severe, then postnatal surgery usually will occur. And then these are my resources.